Are you looking for a way to regain a sense of joy, maybe regain excitement in your life, especially after battling depression? Sometimes the treatments for depression, well, you don't see a big result. We're here to talk about a new treatment, and I'm excited to welcome to the show today Nicole Bruce from Defy Medical. Good morning, Nicole. How you doing today?
Good morning. I'm well. How are you?
I am well. So before we get into this new treatment that I know you're very passionate to talk about, let's talk about Defy Medical first and foremost. What are you able to provide patients? Give people a little background information, if you will.
Yeah, absolutely. So Defy Medical is a medical clinic. We're here in Tampa. We do treat patients in the local area as well as patients across the country. But the main thing that we provide is restorative therapies. We look at the entire patient to figure out where their ailments are coming from. We practice hormone replacement therapy, nutrition. We talk about diet, exercise, sleep. So it's really a comprehensive approach that we take with every patient. And then the treatment plan itself, depending on what the patient needs, is very individualized.
So, people, of course, you heard people talk openly more, and we've heard this in conversation about struggling with depression as, we dealt with this pandemic now for over a year and a half. And I'm assuming you've seen that in your office. And it's kind of ironic timing because you're also talking about a new treatment option that's out there that maybe those people who are newly diagnosed with some of these things or have been battling it for years. What is this new treatment all about?
Absolutely. So ketamine therapy is a newly emerging therapy. It is something that we have been practicing for a little while now. It's actually given through an IV. But what ketamine does is it triggers a process in the brain called synaptogenesis. So that's basically the creation of new synaptic connections between the neurons in the brain. So it can have a very instant relieving effect for depression symptoms. And you're right, because of the pandemic, we have seen an uptick in patients reporting depression, anxiety, even PTSD and other mental illnesses. So ketamine therapy is being widely researched for the treatment of depression, anxiety, PTSD, even chronic pain. And what they're finding is that it's showing significant improvement in depression, especially for those patients that have treatment-resistant depression. So they're having little to no success with other forms of therapy.
Now, when you say ketamine, I feel like I've heard that before. And I was reading about it. You've maybe used it with anesthetic. Maybe that's kind of how we're familiar with it. So how has this kind of new treatment evolved? I mean, what can a patient, if they feel that it's right for them, what can they expect?
So you're right. So it is used in anesthesia in surgical settings, but in a clinical setting, it's used at much lower doses and not in any other combination with any other nutrients or drugs. So it is given through an IV. And it's really, like I said, showing promising results for people with treatment-resistant depression. Typically, antidepressants and medications to treat depression and anxiety can take several weeks to take effect. So ketamine is actually showing instant relief even after one session, which is very promising, especially if you're going through those symptoms and suffering, silently, basically. So what the patient can expect is, our medical director, Dr. Justin Saya, and our ketamine care team consults with every patient prior to administering any kind of therapy. And they walk them through the process, answer questions, and make sure that they're a candidate to receive the treatment before anything is, any treatment plan is started. Once that's completed, the ketamine is administered through an IV through a very low dose, and it is based on weight. So every patient, is monitored the whole time. They're safe. Most patients report that they feel just very calm, very relaxed, maybe a little sleepy afterwards. So we do require that patients have a ride home. And then we typically require several sessions. The IV itself really just lasts about 45 to 60 minutes, and it's fairly quick.
Real fast before we run out of time here in closing, if someone is already on a different treatment for, say, their depression, are they still a good candidate? Can they still explore this option with you?
Yes, absolutely. So anyone who's currently on medication for depression or anxiety, anyone who's currently in mental health counseling for their symptoms, they can still benefit from ketamine therapy. It can really be a great complement or a great addition to their current treatment plan, especially for those patients who believe that their depression was untreatable.
Oh, I think you have been a great addition to our show here today. Nicole, thank you for being with us. We want to make sure and share a special offer that they're sharing with you at Defy Medical. You can get 10% off your first treatment. Check out their website. There's the phone number as well. And also don't forget to mention the Morning Blend, Morning Blend 921. Nicole, thanks for being with us today.